Good day everyone. My name is Ivan Costales from BSN 1C, and today I'm going to assist a patient with turning in bed and two nurses. And so first, assemble the equipments, friction reducing sheet or draw sheet, and bed surface that inflates to aid in turning, and pillows or other supports to help the patient maintain the desired position, and additional nurse or caregiver to assist. And based on assessment, non-sterile gloves if indicated, and other PPEs as indicated. So next, implementation. First is review the physician's order and nursing plan for care for the patient activity, and identify any movement limitations and the ability of the patient to assist with the turning. So next, gather any positioning aids or supports if necessary, and perform hand hygiene. Next, identify the patient and explain the procedure to the patient and introduce yourself. So, good morning sir. My name is Ivan Costales, and ako po yung magiging nurse nyo for today. And siya po si Lawrence Costales, ang magiging assistant nurse po. So, ang gagawin lang po namin ngayon is ito-turn lang po namin kayo sa side ng bed para mas maging comfortable naman po. Okay lang po ba yun? Hindi po. So next, close the curtains around bed and close the door for the room, and position at least one nurse on either side of the bed, and place pillows and wedges of any other supports to be used for positioning within easy reach, and place the bed at an appropriate and comfortable working height, and usually elbows height of the nurse, but lower both side rails. And next, if not already in place, position a friction reducing sheet and under the patient. So my patient has a reducing flow sheet under the patient. And next, using the friction reducing sheet, move the patient to the edge of the bed, opposite the side to which he or she will be turned, and raise the side rails. So, and next, if the patient is able, have the patient grasp the side rail on the side of the bed and toward which or she is turning, and alternately, place the patient arms across his or her chest and cross his or her legs over the leg nearest you. So, sir, may pwede mo kasi po sa lipat, sir. Okay. So next, if available, activate the bed mechanism to inflate the side of the bed behind the patient's back. So the next, the nurse on the side of the bed toward which the patient is turning should stand opposite the patient center with his or her feet spread out about shoulder, and with one foot ahead of the other. And tighten your gluteal and abdominal muscles and flex your knees. And use your leg muscles to do the pulling. And the other nurse should position his or her hands on the patient's shoulder and hip, and assisting to roll the patient to the side, and instruct the patient to pull on the bed rail at the same time, and use the friction reducing sheet to gently pull the patient over on his or her side. So first, one, two, three, go. Then put a pillow on the back of the patient to and pull the shoulder blade forward and out from under the patient. Okay. So next, make the patient comfortable and position in proper alignment using pillows or the other support under the leg and arm as needed. So isa pang okay. And readjust the pillow under the patient's head and elevate the head of the bed as needed for comfort. Comfortable po ba, sir? Thank you. And next, place the bed in the lowest position with the side rails up, and make sure the call bell and the other necessary items are within easy reach. And clean the transfer aids per facility policy if not indicated for single patient use, and remove gloves and the PPEs if used. And lastly, perform hand hygiene. So for the evaluation, the expected outcome is met when the patient is turned and repositioned without an injury to an patient or nurse. And the patient demonstrates proper body alignment and verbalized comfort. And for the documentation is be sure to document the time that the patient's position was changed and use of supports and any pertinent observations, including skin assessments, and document the patient tolerance of the position change, and document aids used to facilitate movement. So that's all.